right room. Can we start our meeting now? Okay. Good afternoon, ladies and gentlemen. We're going to have our meeting. If we can start the meeting with the Pledge of Allegiance, and we will then get started. Pledge allegiance to the flag. Okay. Okay, today we have with us Marie Allen from SWACA. So I'm going to dispense with a lot of the normal formalities and give, however long she'd care to speak for. We're more than happy to listen. Because from what I understand, SWACA is a very beneficial entity in the state, which I am embarrassingly not that familiar with. So maybe Kathleen, since you went through the efforts of getting Marie here, maybe you could introduce her and give us a little bit of background and then turn it over to Marie.
First, thank you, Marie, for coming. Marie Allen is the CEO and president of the Southwestern Connecticut Agency on Aging. I think you've been there about 18 years?
Yes.
18 years. The Agency on Aging is now 50 years old. It was originally formed by from the Older Americans Act, which I think Marie can speak to. And anyway, I'm really happy that she could come. There are many, many wonderful programs that she oversees there with her team. So welcome, Marie Allen.
Thank you very much, and thank you for having me. It's a pleasure to be here. SWACA is the Southwestern Connecticut Area Agency on Aging. We are one of 5 regional agencies in the state of Connecticut designated by the federal government to support programs and services for older adults. There are 666 area agencies on aging in the nation, and 5 of them here in Connecticut. We're all part of one association called U.S. Aging. The purpose, back in 1973, the federal government decided that they would create funding for older adults, and the funding would be allocated to every state based on the number of older adults living in those states. They needed a mechanism to get the funding from the federal government to the programs and services that were most important to the state's residents. And to do that, they decided to designate area agencies on aging. And Edith Serkey was the original director of the Area Agency on Aging in Southwestern Connecticut. And it started with a need for home-delivered meals. It started with the recognition that as people were aging in their home, they were finding it difficult to get food into their homes, and especially food that would provide nutrition and also a safety check for individuals who might be living alone and have no one else to visit with them. So they began with a very small home-delivered meal program. They coordinated the program with Salvation Army at the time and Catholic Charities. And food was prepared in commissaries and catering companies, and then a fleet of delivery trucks and volunteers would deliver the food to the homes. That was the first program and the initial funding through what is called the Older Americans Act, which is still in effect today, which brings in approximately $21 million into the state of Connecticut every year. The dollars are then divided between the 5 area agencies on aging, again, by the number of older adults that are in the community. The Southwest region encompasses Greenwich, all the way down to Stratford, out to Monroe. We have 14 cities and towns. We're one of the smallest number of cities and towns in a region. However, we have the largest number of older adults of any area agency on aging. So our funding comes in through the Older Americans Act. It stops at the state. The state accepts the money at the state unit on aging, and then it is distributed to the 5 area agencies on aging. We have an awesome responsibility to take those dollars and take care of all of the home-delivered nutrition programs, the congregate, which really it's a word that means community sites. So as here in Trumbull, we have a nutrition program, and it is supported by the Older Americans Act dollars that come through SWACA. We also take approximately $1.5 million and we provide grants. You might be familiar with adult day centers like Grasmere at the Jewish Home, now called Mosaic, Elder House in Norwalk, River House in Stamford, Sunset Shores in Stratford. We also provide support to senior centers, certain senior programs. Here in Trumbull, we have supported your caregiver support groups. We provide the funding, and then some wonderful director like Michelle Jacob will take that funding and turn it into a program that makes sense for the community. We provide transportation funding, especially in areas where there are limited public transportation. We do have to prioritize older adults who are at the lowest income and are underserved for some reason. It could be that they are disabled. It could be that they have limited English proficiency. That is the charge from the federal government for the use of Older Americans Act dollars. So we do have to prioritize. We always receive more requests for funding than dollars available, and I'm sure that doesn't surprise anyone. So we use a board of directors. I have a 16-person board of directors, and then we also have an advisory council with representatives from every city and town we support. And Kathleen Bordelon happens to be the chairman of our advisory council. We bring together approximately 30 individuals, and we hear from them what's happening in the communities, because what's happening in Stamford might look very different than what's happening in Trumbull. And based on the needs of the seniors in those towns, the board and the advisory council make the decision about which grants to fund and how much to fund. So it's very important to realize that although we have an organization, a strong organization, it is really run by the people who serve it, the board of directors and the advisory council. Those decisions are not made by staff. My job is to make sure that the board and advisory council get all the information that they need, that we've checked audits. We check through the city's audit or a nonprofit's audit to make sure that funds are used appropriately, and we confirm that the goals set forth in the grant are realized by the end of the grant term, which is usually 1 year. So that is a very quick summary of what the Area Agency on Aging does as designated by the federal government. There's another side of the Area Agency on Aging. We're called an access agency for the state of Connecticut. We provide access to individuals in the community who qualify for Medicaid to allow them to stay in their home, give them an alternative to nursing home placement. So how does that work? For an older adult who runs out of money, or perhaps never had money, has lived in poverty all of their life, when they age to the point where they need help in the home, most often they would go to a nursing home because there would be no way of keeping them in their home unless they had family who was able to do round-the-clock caregiving for them. The state of Connecticut back in 1987 created a program called the Connecticut Home Care Program for Elders. They went to the federal government, the state went to the federal government and asked for a waiver of the Medicaid rules. They asked that instead of using Medicaid, which is an insurance funding for very poor, very sick, older individuals, instead of using it to put people into a nursing home, could they take a percentage of the funds that come to Connecticut and use it to allow people to stay in their home? So my agency has 115 employees. Most of them are social workers, some nurses. And what they do is they go out into the home. They do an assessment on an individual who would like to stay home but cannot remain home independently. They put together a care plan for them, which might include visiting nurse, a homemaker, a companion, a personal care attendant, home-delivered meals, transportation to doctor's appointments. And this care plan allows the individual to forego institutional placement. They don't have to go into the nursing home because they can safely remain at home. And the social workers and nurses go and check on them once a month and make sure that the care plan, the services that we've put into the care plan, are actually performing as they should, and that the person is able to remain in their home. To me, it's one of the most outstanding things that the state government has done because it allows someone to live out their lives with independence and dignity that they would not have had. They would have had no other option but to go into that nursing home. And from the government's standpoint, the state pays 50 cents on every dollar for Medicaid. 50 cents comes from the federal government, 50 cents comes from the state. If someone goes into a nursing home, Medicaid is going to be the payment source for that nursing home. Nursing homes are 3 times more expensive than community-based care. So from the government's perspective as a fiscally responsible government, it makes a lot of sense to use Medicaid dollars for community-based care. Number one, because that's where people would prefer. I've worked in senior services for almost 30 years, and I have never had someone say, please help me get into a nursing home. I have had many, many people ask me to help them stay out. So it's a very humane thing to do, and it's also fiscally responsible. It's one of those wonderful things that works for both, to be both fiscally responsible and also to have compassion for the people, the residents of Connecticut. Right now, in our region, we have 3,800 individuals on the Connecticut Home Care Program for elders, and that's just our region. Throughout the state, we have over 15,000 individuals on the Connecticut Home Care Program. As you can imagine, even if you did everything right, there are some people who will outlive their resources. And when that happens, they should not be forced to go into a nursing home. That shouldn't be the only alternative. So we've seen many families, husbands and wives in their 80s who are able to remain together in their own home because of the supportive services. Yes, sir.
You keep saying home. What if an older person is running out of money, renting an apartment? Let them stay in an apartment.
Do you mean could we help them pay the rent? No. So Social Security or whatever income that they have would have to continue to pay for the apartment. And most of the individuals that we serve have Social Security. So whether they're in an apartment, some live, many of your neighbors, you'd be surprised. There are people right on Main Street in every city and town in our southwestern Connecticut region who are on the Connecticut Home Care Program. They were able to, they've purchased their home. They're somehow able to maintain it. They still qualify for the program, so they get all those supportive services. Now, if they had to pay for the supportive services, having an aide in the home could be as much as $6,000, $8,000 a week. So that is what prohibits people from staying at home. And if you're having trouble with what we call activities of daily living, dressing, bathing, toileting, transferring, managing your medications, if you can't do that on your own, you must bring help in or go into that nursing home. So no, we don't pay the rent, but we pay for those wraparound services. Yes, sir.
I don't mean to break into the conversation.
No, please.
But I mean, as far as you're giving us an overview of what's happening, Mark, you touched on an interesting topic. If someone, wasn't aware that you could take advantage of those facilities and still have your home.
Yes.
I thought you had to dispose of assets and various things, but the home was kind of left alone.
The home and one vehicle.
It's getting better. But the thing is that you said it almost covers all levels of home care. Yes. For a person as opposed to going to a nursing home or a facility. Mm-hmm. I guess they have to spend down all of their incomes to get to a certain level to qualify for that?
You're absolutely right. They have to spend down all of their assets. It's not so much their income. Your income is almost unlimited under Medicaid. You can go up to about $2,900 a month in income. And if you have more than that, you could still qualify for the program, but you might have to pay a cost share because you are over that income. Assets is where it gets really tricky, and that is what we have been working on. Kathleen, the advisory council, the board, we are going to have 2 legislative breakfasts in January to increase the asset level, because right now to qualify for Medicaid, your assets can be no greater than $1,600. That's liquid assets. That does not include the home. That does not include a car. However, $1,600, as you can imagine, if you live in a home,
Can't maintain the home.
how can you maintain the home? And that has been our argument to the legislators for a very long time. And I think this might be the year that we get them to move on it. New York has just increased their asset limit to $30,000. New Jersey is trying this year and thinks it will go up to $10,000. Connecticut really cannot stay at $1,600. It has been $1,600 since 1973.
That's annual or monthly, that $10,000 or $30,000?
That's assets. So whatever you
Oh,
have in your
assets.
bank account.
I thought
Yes.
you said income.
No, assets.
Okay, thank you.
Yes.
That would have, if you had an IRA or something, that would be considered an asset.
Yes, it would. Yes. Even sometimes we look at life insurance policies. The state it will find every penny that an individual has. They have the authority to use your social security number and confirm any assets that you have. So the face value of a life insurance policy would also be included because you could liquidate that and use that for your care. Now, I know that sounds very harsh, and it is very harsh. $1,600 is absurd. However, when you look at it from the taxpayer's view, the taxpayers are supporting Medicaid. The 50 cents on every dollar that comes from the state is coming from our taxes. So if we just open up the doors and say anyone could be supported on this program, or you can keep $100,000 and still benefit from this program, then the taxpayers are supporting people who are holding on to their own money. And typically, when they pass, it will go to their children, but it never really replenishes the coffers of the state. So,
I have another question. You mentioned,
Sure.
I know Social Security comes out of earned income. Mm-hmm. I'm going to display my ignorance about finances here. Does Medicare come out of taxable income also? Like, if you're working as an
Yes.
employee, do you pay Medicare tax along with Social Security tax?
yes,
So
absolutely.
they're two separate deductions.
Correct. At different percentages. Yes. Medicaid is not necessarily paid for. That's not a tax on earned income, but Medicare and Social Security, both. Medicaid if they're not already on it. Most people are not already on it, and so we go through the application process, which is extraordinarily complex and a real barrier for someone who has to do it alone. It's written in legalese, and lawyers will charge $8,000 or more for a Medicaid application. If someone has historically been poor, it's a fairly easy application to get through. If you had some complicated financial, like annuities or maybe a reverse mortgage, it becomes a lot more complex. Yes, sir.
You talk not on the access agent, your grants. You would give grants to someone like Michelle for the senior center. Do you also offer grants to, say, someone like the Bridgeport Rescue Mission, which has seniors in that organization, maybe could get some extra help if your programs would allow grants to the organizations like that?
We do. We do not currently have a request from the Bridgeport Rescue
No, I just use that
Mission,
as an example.
but if they did apply, the money must be used for individuals 60 and older. So it would have to be a program, perhaps older adults who find themselves homeless, who are trying to relocate into senior housing, something like that. Family and Children's Agency, if you think of that, that's a big umbrella organization that helps families with adoption services, but it also has a program for seniors. We give them a grant specifically for the senior program. We can't
How
fund
do you let
others.
organizations, because my organization donates money to Bridgeport Rescue Mission and the Kennedy Center every
Yes.
year. How do you let them know that they are able to get money through grants?
Great question. The newspapers used to be very popular, and you may have noticed they're not as popular anymore. So we used to put a public notice in, and that would bring grantees to us. That's not really very effective. Now we use Facebook, Twitter, our website. We have a huge list. We worked with the United Way when the United Way was very engaged in all of our communities, and we took their list of nonprofits and we send out postcards and emails to tell them that there are funds available. We currently do fund things like Bridgeport University has a dental program, and the Phones dental program. We fund them. They come to one of the Bridgeport senior centers and provide routine cleaning, oral health cleanings and checkups, which is something that for many of the residents of Bridgeport who are well below the poverty level do not have funds for dental care. So truly important programs like that. Connecticut Legal Services, which helps prevent eviction of older adults. We fund them with a large grant every year because they've done some incredible work helping people stay in their home, and nothing could be more important.
How do you do what you do with the limited income that you get from the state? Because the numbers, I think, was like 3.5 million. I mean, those numbers could be gone in no time, it would seem, with the number of people you're dealing with.
Yeah. Well, remember that Access Agency is separate. So the $3 million is really coming just for grants. On the Access Agency side, where the nurses and social workers are going out to visit clients, we are paid for every client that we support. We're paid an hourly rate for every client. That is paid through Medicaid. So that's, again, the state and the federal government are paying that because, again, that's saving the state a lot of money. The only way these clients get on the program is if they're at nursing home level of care, which is a clinically technical term that means without care in the home, this person would not be safe.
Not to be harsh about it, but that burden that is cast back on the federal taxpayers.
Say that again?
That burden to pay the additional monies from Medicaid will come from the federal level more so than the state and local level.
50-50. It's a 50-cent match. Medicaid is on every dollar, 50 cents comes from the state, 50 cents comes from the federal government. So it is, and it's all us, right? Because we're paying
Well, it
federal
ultimately
taxes and
yeah.
state taxes. So ultimately, it's the same person who is paying into the federal and state coffers, paying our taxes to provide services to individuals who can no longer remain safely in their home. But in the United States, if someone really cannot live safely in their home, they will go into a nursing facility. And the nursing facilities, many of them, most of them are for profit. And even if they're not, you still need to pay your staff, the nurses, the aides, et cetera.
An interesting point that just popped into my head.
Sure.
Social Security benefits stop, or not benefits, the deduction stops at around $170,000, $180,000 this year. Mm-hmm. Is there any cutoff for Medicare and Medicaid contributions?
Well, Medicare, the amount that you pay monthly for Medicare
Right.
goes down based on your income or goes up based on your income. If you're over a certain income, you're going to pay more. I believe right now it's $174.90 per month that individuals pay monthly for Medicaid. If you are over a certain income threshold to $106,000, you're going to pay more, and it steps up because you have more income.
Is there ever a cutoff on that, or is that
There
continued?
is a cutoff. I don't want to speak out of school. I don't remember what it is.
But that's a
there is
whole nother
cutoff.
conversation I take issue with. Why do we even have cutoffs, like specifically for Social Security? I mean, if that's wide open for all earners, it's ridiculous the amount of money that's going to come in. And if that's the same concept with Medicare, the same thing applies. So now we're dealing with potential deficits at least in the Social Security area that we're, 2020, 33 or whatever number
Right.
it is. I really see no movement. What do I? That time. It's another It's an interesting topic to address relative to. I'm getting answered here. I apologize. But it's an interesting topic to address relative to the levels of income and monies that you have to work with.
Yes, it really is. And we negotiate with the state because we are a contractor for the state, and we have to negotiate a contract. We're supposed to negotiate it every 5 years. COVID did put a delay on that, and that negotiation is so that I can pay my staff fairly and equitably. These young ladies are social workers and nurses, and they're going into some of the worst neighborhoods in southwestern Connecticut, and they're doing their level best to help people stay in their home. They need to be able to feed their families and have decent health care benefits for themselves.
So do you have to terminate any benefits that you offer to people, or do you just operate a continuing deficit with? No, you can't operate a deficit. You have to pay people.
No, Medicaid allows, there's a care plan limit. So that care plan limit is approximately $6,550 per month. There's all kinds of exceptions if a person has certain acute illnesses or is in the last stage of their life, in other words, on hospice. We do have some exceptions, but for the most part, it's about $6,550 per month. And for that, we are able to put together a package of services that helps them stay at home.
I don't understand it. I have a friend who's in Bishop Wick. It's about $15,000 a month.
Yes.
And you said they will allow $6,500, and I guess you explained some type of the extensive care that they would get for home, be it bathing, health care, bathroom facilities, and the whole thing. How does that cost justify for somebody staying home at $6,500?
Right. You might remember at the beginning of the presentation, I said you can stay at home for about one third of what it
Yeah.
costs you to be in a facility. Remember, when you're in a facility, you're also paying rent. You're living there. So in addition to the care that's in a skilled nursing facility, they're also charging you for the grounds, for
Right.
the room that you're occupying.
But it's
for the-
24/7 coverage also.
It is 24/7, but so is some of our care plans are 24/7 too. We have personal care attendants that live in the home with. Imagine someone with significant dementia. You really can't leave them alone at night because they might get up and wander or harm themselves. So we do have some 24/7 plans. They are the most expensive, and those are the ones that get right up to that $6,550 maximum. However, we're not, the individual is still paying for their housing. So in the nursing home, you're paying the housing as well as the care. You're also paying for extraordinary care in a nursing home. You have RNs on staff. An RN is going to command a salary. A registered nurse will command a salary that a personal care attendant would not.
But this is low-income people to start with. So I don't understand how they can afford to pay, or
They don't.
You can afford to pay the little over $200 a day for them.
Medicaid does.
But what? How much does that pay for a person to be in their home for what period of time to offer what services?
Okay.
I don't see
So-
how that could work out profitably for you.
Oh, it does. We're
I mean,
a
not
nonprofit.
profitably. I mean, but to address the needs
Sure.
as they should be or
Sure.
have to be.
You're asking great questions, and let me try and explain it a different way.
I apologize. I'll shut up for a while.
No, don't, please. This is so important. This is so important to learn. This is so important to understand. When a person runs out of money or does not have the money to pay for Bishop Wiki at $15,000 a month, eventually, if your friend runs out of money, and I'm not asking what his personal situation is, but when he does run out of money, Bishop Wiki is not going to put him outside on the steps. Medicaid funding will step in and pay Bishop Wiki. Now, they have a negotiated rate. While he's privately paying, he's paying $15,000 a month. The negotiated rate with Medicaid is probably closer to $10,000 or $11,000 a month. But Medicaid is going to pay that. So from Medicaid's point of view, from the people that run Medicaid, I can either pay for Paul's friend to be in Bishop Wiki at $11,000 a month, or I can pay for him using those same Medicaid dollars. It's one bank account with Medicaid in it. Or I can pay for him to have 24/7 care in his home at $6,500. So the Medicaid dollars have to be there. That's the promise of not putting our elders out on the street and leaving them with no one to take care of is a national promise. That's what the United States says. So if someone gets old, frail, very sick, and cannot stay in their home anymore, and they go into a nursing home, Medicaid is going to pay for it, not Medicare. Medicare stops. Medicare will pay for 150 days in a nursing home, and then it stops. So if you live for a year in a nursing home, 365 days, maybe the first 100, 150 will be paid by Medicare. But once you become what they call long-term, you're not going back out, it flips over to Medicaid. And Medicaid is going to pay either that $11,000 negotiated rate or 65. So this state was very smart in saying, let's develop this program that allows people to, number one, live out their lives with independence and dignity. Number two, costs the government less money. Did that clarify?
Own a home.
Yes,
I assume they don't have a mortgage anymore. It's paid.
that would be an assumption, yes.
So the house has a value. So the state doesn't look at that and say, well, listen, we'll take care of you, but your house is worth $250,000.
Great question.
We want that.
Yes, great question. Not while you're alive, but maybe when you're dead.
So it's
So-
almost like a reverse mortgage?
It's what will happen if you spent on your care plan, remember at about $6,000 a month, what are we talking, $76,000 a year. Let's say you're on the Connecticut Home Care Program for a year. The government has paid $76,000 for you. And I'm going to make the math easy for me. Your home was worth $376,000. You've passed away. It goes to probate. You've left your home to your son. When your son goes to probate, he will see a lien on his home, on your home, for $76,000, not for $376,000. And that's very important to know because many elders will forego care because they think their home will be taken away and it will leave nothing to their survivors, their children. Medicaid can only take from probate what they paid on your behalf, every penny.
Paying goes beyond the value of the house. They continue it, do they?
No, they cannot. They
No
cannot.
house now and no pay.
That's correct. They cannot take your home away from you while you're alive. And if you have a spouse, so if it was my husband and I was the one on Medicaid, and I pass away, they still cannot force the home into probate because my husband is the owner of that home. When he passes away, now if he's really strong and healthy and he lasts enough years, they probably won't come back and take it. But if he passes away the next year, there's a very good chance that the state will come and take the value of the care that they provided to me. They cannot touch your house while you, your spouse, or a disabled child is living in the home. And by disabled child, it could be someone with a Down syndrome. They might be 50 years old, but still living in that home. So there's a lot of urban legends around what Medicaid will do, and it's so important to debunk them because I've seen people go without care because they think, oh, I can't do this to my children. This is my gift to them. This is what I want to leave to them. So instead, they struggle in their own home. They fall getting out of a shower. They end up in a nursing home. And the nursing home at $15,000 a month very quickly takes away that home anyway. If you go into a nursing home, within 90 days, your home must be put up for sale, and there must be reasonable effort to sell the home so that you can pay for your Medicaid. That doesn't happen on the home care side. So really, there's a million different things to talk about in that area. It's so important that you take advantage of an elder lawyer if you're starting to do Medicaid planning, and that's an important piece of knowledge for the commission to share with other elders in the community. There are ways, there are pooled trusts, there are other mechanisms of protecting your assets if that's something that you would like to try to do in the with the potential that someday you may actually need Medicaid. Nobody thinks they will, nobody does. But I've seen many people who have planned very well and unfortunately still end up needing Medicaid.
Michelle, have we ever had presentations along these lines at the senior center?
Yes. Ronnie probably has, I think there is an attorney, an elder law attorney that comes quarterly to the senior center, and she lets individuals ask questions. She does do free consultations, very quick, consultations.
Oh, yeah.
And we've had a lot of panels. We do have them come in. I was going to recommend maybe the commission would like a guest speaker, or if that's not appropriate, we will get one going right away after this conversation and have an elder law attorney come in and answer questions.
I would be afraid to discuss any of these topics. What's that phrase? It's complex.
It is.
So it's yeah. I mean, I didn't realize there was this much involved, and like, not that the system was as generous as it is, but how, for lack of a better word, as fair as they can be,
Yes.
and still not go out of business.
Yes.
Or run out of monies.
Yes.
You mentioned two things. One short one. If a person has a reverse mortgage, that's considered an asset.
It depends on how the reverse mortgage is paid out. That's one that I'm going to leave for the attorneys because that's very complicated. If you're taking monthly payments from the bank that has provided you with the reverse mortgage, it's handled different than if you take a lump sum.
Or if you have a line of credit.
Correct.
The other thing, I just want to clarify, your agency, essentially you put together the package. When someone requests to be evaluated for elder services, your agency goes out and says, okay, you need this, you need this, you need this. Do you actually deliver the services, or do you give them, oh, you do? So
No,
is that-
no, we do not. That's a
Oh,
great
this-
question.
Okay, so you go to like VNA or somebody like
Correct.
that. Okay.
We work, the state has something called the Medical Assistance Program, which is an arm of Medicaid, and providers, the visiting nurse services, all of the home care agencies, there's Care Finders, there's Keep Me Home, there's hundreds of them in the state. They are vetted by the state. They have to provide a certain level of insurance. They also have to have personnel policies, background checks for all of their aides. There's a list of requirements, and if they pass all those requirements, they are put onto a list that any of the access agencies, our agencies who go out and build the care plans, can use. So we would go to Mrs. Jones's home and say, okay, Mrs. Jones, you need a personal care attendant for 4 hours a day, 5 days a week, and you need home delivered meals. Do you know of an agency that you're interested in using? And she might say, well, my neighbor uses Care Finders. I think they're a great agency. I'd like to use them too. Then fine. If she says, no, I'm not aware of any agencies, I don't know, then our job as the access agency is to be unbiased about who we select, and we give her 3 names. We use a randomizer. It goes through an Excel program that every day 3 new agencies come up, and those are the 3 agencies that we refer to for that day. And then the client will call each. We highly recommend that they interview them and find out if that's a good match for them, and then that's the agency we would use. We are responsible for purchase orders, giving them the purchase order that says we will pay you for those 4 hours 5 times a day. Without that purchase order, the agency wouldn't get paid. So we write all the orders almost like a prescription. We put it into a billing portal, and then the agencies can go and bill from there.
How many agencies are there? How many agencies are there?
200, over 200.
Do they bill you, or do they bill Medicaid Direct?
They're billing the state of Connecticut, who has the Medicaid dollars. I'm sorry that this is so complicated. It really shouldn't be. Do you know, it took me 3 years after coming to work at this agency to understand how to do this. So I can only imagine that in our half-hour conversation, it's not. It's a lot to digest. It's again a wonderful. I've seen families get to stay together. We have clients who live with their adult children in a beautiful home, but the daughter has to work and she has to mind the children and get them to soccer practice and do all those other things. She can't leave mom alone. So this program can come in and provide aids in the home. The daughter goes to work. Mom is still in a loving family. It's a beautiful thing. A husband who would think that he has to put his wife in a nursing home because she has dementia and he can't manage her personal care needs. And we can get an aide to come in, and the husband and wife stay united through the end of life.
They gotta be below the income level.
Absolutely, absolutely. If not, you'd be paying for it yourself. And our agency also helps guide people who are above the income and asset level, and we can teach them and explain to them how to use your own dollars for home care. That's not an easy conversation because nobody wants to use their own dollars for home care. I've counseled millionaires who tell me they're saving it for a rainy day at 92 and it's pouring out. So it's not an easy conversation, but
Well, above a certain income level, also, there's long-term care insurance too, that's available. It's not cheap,
Well,
but
can't
it
get it
certainly
now.
gives you like
Yeah.
$300 a day per person and stuff like
Yeah,
that.
but an outrage, we probably couldn't afford it. Or
Well,
if
I just said,
or if it
above
did,
a
it'd be a
certain
bad
level,
investment.
you'll get the long-term
yeah.
care.
Unfortunately, you have to start that at a younger age too, because the older you are when you initiate a long-term care insurance policy, the higher the premium. And another thing that has happened is some of the insurance companies have greatly increased their premiums. So even someone who bought it perhaps when they were 55, at 80 can no longer sustain the premiums, and that's real tragic.
Usually, if you get to that point, actually with my father, I have it, he did too, they offer him a buyout.
Good, good,
So you can either continue paying the increased rate, or they'll give you a buyout.
good, good. It is.
Can I just share real quick? I just wanted to share an experience. You all know Jennifer Gillis, I hope, our social services coordinator. And Jennifer is the person that would probably reach out to Marie's agency and make the referral on behalf of a client who's come to her for help. And, Jen knows all of this. Jen's been doing this for years. She does a great job. Before I came to Trumbull, I had Jennifer's role in Norwalk. I worked very closely with the Agency on Aging, referring family after family, isolated seniors. And you do see the benefits of, walking somebody through this program, and they know that they can stay in their home. It is so important. And, there came a point where I ended up helping a family member get their mother on the program. So I called myself. One of Marie's staff members came out and met with us, did a wonderful job. They helped with the application. They helped get bank statements together. This family member had been spending down money for years on care. They did not expect. They thought they were prepared. But, home care is expensive. I think they were paying $8,000 a month. And the Agency on Aging came in. They were able to work with the agency that this woman already had. She was able to keep her caregivers. And I think in the beginning she received, care every day. She had a life alert button if she fell. I think she got Meals on Wheels. And then when she declined, the family said, well, we'll take care of the meals. We'll pay for the life alert. And they were able to pay for 24-hour care for her. So, people don't expect this to happen. But it is an amazing program. And it's wonderful to see somebody be able to stay in their home and not end up in that nursing home. Because we all think we'll never get there. But
Yeah, thank you, Michelle. That's so indicative of the people that we support every single day. And I'm so thrilled to come here and talk to you about it because it's horrible when I see a family who, for the last 5 years, has been struggling and so overwhelmed by care for a loved one, and they knew nothing about the program, and we could have been in there so much earlier. When someone is in the last stages of their life, the family needs to be there to be their friend, to be a sense, to share compassion, to laugh and joke. And if all they're doing is caring for, personal care, showering, toileting, feeding, then they're losing that opportunity to really spend quality time at the end of someone's life. So it's imperative that more people know.
Can you go into Bridgeport Rescue Mission and make a presentation to make them aware of what might be available through a grant for them?
Go to whom? I'm sorry.
Bridgeport Rescue Mission has, these are people on the very lowest end of the
Yeah,
income
yep.
level. And they have elderly people and they don't, and people with children.
Yeah.
Do you ever go into an organization like that and let them know what's what grant they might have available to them?
I don't think we have with Bridgeport. For the Medicaid program, there is a requirement that you have a home. So someone who is homeless could not get our services because there's no home to send the aides to or the visiting nurse to.
But that wouldn't be the access agency. I'm
Oh, you're talking about the
one
grants. I'm
getting a
sorry.
grant.
I misunderstood. No, we don't go in and promote it, but they are on our list of getting the postcard. Here's what's available. If you'd like to apply, please come and apply. There are so many nonprofits. You would be surprised with the number of them. And I have one grants manager, so it would be unrealistic to think we could go to each agency and encourage them to apply for a grant. As Kathleen can tell you, there's just not enough money, and it's extremely competitive, so we don't want to give everyone false hope. This year, our funding went down 35% from last year. The reason for that is ARPA, American Recovery Plan Act, the dollars that came from the COVID, the public health emergency. We received almost double the dollars for grants for 3 years during the pandemic. And it was because people requesting home delivered meals, as you remember at the beginning of the pandemic, older adults were encouraged not to leave their home, not to even go to the grocery store. And our requests for home delivered meals doubled almost overnight. So much of that money was spent on things like home delivered meals. We also did a grocery program. I think Trumbull participated. Yeah. So we did a grocery program with the Vizanos, the Vazzi family. We were able to have them go and pick up groceries, and then we delivered them to every city and town, Stratford all the way down to Greenwich, and then volunteers would come and get the groceries and bring them to seniors' homes. So the money was well spent, but it gave us additional dollars to put out in the community. And this year we kind of fell off the cliff. There's no more recovery plan, so now it's not really a cut. We're back to where we were in 2019, pre-pandemic, but the community, the nonprofit community feels the pinch.
It almost seems then your success is going to be to your detriment.
I think about that.
If you service too many people, you're going to run out of money.
Yeah.
Well, with that in mind, though, how does the organization notify people of your services? I mean, I'm embarrassed to say, if I didn't come, I've heard the SWACA acronym from some meetings, and that's about it.
Okay. Most of our referrals come from the hospital. So as you can imagine, when someone is really struggling with their independence, they tend to either have a fall or become ill.
Right.
And the hospital will say, part of the discharge planning process, if you've ever been in the hospital and looked at discharge, they're looking at the safety. What resources do you have at home to help you in your recovery, as you recover from whatever reason you were in the hospital? The discharge planners at every hospital have us on speed dial. We communicate with the hospitals every single day, multiple times a day. Physicians, gerontologists, especially gerontologists, are all aware of our programs. So as someone goes for what they call a geriatric assessment, mostly due to some cognitive issues, Alzheimer's or dementia.
Is that primarily the only or one of the the best way that people are notified from, as opposed to no public
Jen Gillis.
dissemination of information? Well, yeah, but people have to be either referred to Jen or know about the program, perhaps
Yeah.
through the senior center.
Yeah.
Michelle?
We do put it in our newsletter on a regular basis. And, this question gets asked to us all the time. I think anytime that we're responsible for funding is, how are you getting this message out to the people?
Yeah.
And I don't know how to reach people. Maria, I'd love to hear. I'll have a conversation with you one day, but we put it in our newsletter. We email it. We put it on Facebook. We put it everywhere we can. There's flyers hanging in the building, but no one's reading it.
Yeah.
And I wouldn't either. I'd pick up the newsletter to look for my exercise class and my other program that I attend. Why would I read this entire notebook? But we do have important information in there, so it's important to glance through. But it is a good question. How do we get that message out there to everybody?
In your senior center, I don't know how many seniors you have in your center, but as Kathleen said in the last meeting, a quarter of the people in Trumbull are seniors. And
Yeah.
a quarter of the people in Trumbull are not going to the senior center. It's a good number, but it's nowhere near a quarter of the population. So how do we let all those people know?
Yeah, it has to be a multi-pronged approach. It really does. And as you can imagine, Medicaid is going to pay for those programs and services. They're not going to pay me for advertising dollars. I have no marketing budget. We have no marketing manager at our organization. We have nurses and social workers who go out and help take care of individuals. So what we do is I try to attend every city and town, a meeting in every city and town at least once or twice a year. I've been here, I've spoken to Michelle's staff, we've had meetings. Ronnie is on our advisory council, so she's bringing information back and forth. It has to be, it's almost what we call guerrilla marketing. We've been on WICC, we've been on many different radio stations to try and get the word out. We put ads in senior newsletters. We talk to geriatricians, elder lawyers. We have meetings. I present before the elder law bar at least twice a year. That I always do, because many times a person will start there. I'm getting a little worried about how I'm going to pay for care, how I'm going to maintain my home. Elder lawyers make many, many referrals. Senior housing, when you look at areas, even here in Trumbull, you have a wonderful senior housing complex. And we communicate with Paulette Mack and Lisa Alhabal at those sites constantly. They're constantly referring clients to us. All of the Bridgeport housing, senior housing, we have them in for meetings. We try and keep them abreast of what services are available. In Bridgeport, we actually send social workers into the senior centers because they do not have as structured a senior center program as you see here in Trumbull. So we try and support them that way. But you're absolutely right. It should be more commonplace. How many people really want to talk about long-term services and supports? It's not a popular conversation. I saw it in my own home as I tried to talk to my mom and dad about, okay, what do you see happening here? and what do you think is going to happen in a couple more years? And who's taking, oh, you'll come and take care of us.
And it's embarrassing for older people to have
It
this
certainly
discussion.
is. It certainly is. And money. I mean, my father would never talk to us about money. It was none of my business. He provided for us, and that's the way it was. And I never knew how much money he had in the bank, and he didn't want to tell me. It wasn't until the very end when, unfortunately, it becomes almost a little bit of a crisis. You know, a cancer diagnosis. I have 3 months to live, and all of a sudden, he wanted to share everything. That's a really hard. It's very difficult for a family to talk about. But I think as people are aging in place, staying in their homes longer, it is becoming a little bit more commonplace to think about, how do I want my final years to look? And what if I can't take care of myself independently? And having those conversations with a trusted family member, friends, within your congregation, whatever is important to you, is critical to making sure that there's not a snap decision, because I've seen it a million times. The hospital says this is not a safe discharge. The family says, well, we don't know what to do. Send them to a nursing home. And for some, it's almost like the death by heartbreak. So
I feel a lot better now just from hearing a lot of this. Not that I understand any great depth, but just the big picture. But I do feel kind of gratified that, number one, we have Kathleen, who is involved in that. We have Michelle, who's aware of it. We have Ronnie, who's aware of it. And we have Jen Gillis.
correct.
So we do have some resources, but I wasn't aware that they were a resource for this.
Oh,
So it's-
absolutely. Jen Gillis served on our advisory council for 10 years. She was the chair prior to prior to Kathleen becoming the chair. So Trumbull has been greatly represented through SWACA.
Also, all of your grantees are partners in the community, right?
Yes, yes. We have approximately 40 grantees and agencies, nonprofit agencies that have received grants, and they help spread the word about SWACA, about the access agency side of it too. Many of them are working with older adults, and that's the beautiful thing about a senior center. Someone comes in, perhaps they're 70, 72, they're playing cards, they're going to exercise, they're enjoying a lunch with their friends, and 5 years later, they're starting to slow down, they're forgetful, maybe their car is running in the senior center parking lot, little things like that. And that's where Jen Gillis will step in and start to keep a stronger eye on that person. And then a few years later, they have pneumonia, they're in the hospital, they come back, and they're just not coming to the senior center. Jen's going to follow up with either a home visit or a call, get the family involved, tell them about SWACA.
You're a really upbeat person, aren't you?
It is upbeat because we're providing care. At the end, it all works out.
Horror stories.
Yeah, that's true. That's true. You know, my husband just retired from Sikorsky after a lot of years, probably 45 years at Sikorsky, and he asked me the other day, because I'm still working, obviously, and he is retired and I guess has more time to ruminate. And I've been at this job, as Kathleen said, for 18 years, and I was the director of the Norwalk Senior Center for 10 years before that. So I've been involved in senior services for a very long time. And he said to me again, over coffee, "What do you do again? Can you tell me what you do again?" So he's like, I just still don't really understand. So I completely get it. And then when I do start to tell him, he says, "You're not a very upbeat person, are you?" He'll say that same thing. So yes. But at a cocktail party, when you have people my age who are dealing, or maybe a little bit younger, dealing with their parents, I become very popular when they say, "Oh, she knows all about taking care of older adults." And then all of a sudden, everybody wants to have a conversation. So that's a good thing.
I wish I had a bunch more questions. There's so much going on, it's hard to just get your head around it.
Yes.
Because I think that the basics have been covered. I have a big understanding. There's a lot more support from this group through Medicaid that I was aware of. Mm-hmm. And I think I was one of those people who assumed that the only thing that was sacred when you went to Medicaid was your home.
So you said you had a card with what you offer from? You said you have cards that you can give to people, because I have a couple of organizations I'd like to make them aware of what you guys might be able to do through grants.
Why don't I share the website with everybody, and then you can share that with everyone? Because the
Yeah.
website is extremely thorough and very informational. I think you'll find a lot there.
Thanks.
And how to apply for a grant is right on that front page. So they can go right there and follow the steps.
We have Kathleen.
That's a wonderful thing. You have Kathleen, you have Michelle, you have
Yes.
Jen. You've got like a super team here. So
We're very fortunate to have you, to have the people that support the organization. It's just that we try doing what we can, but sometimes you question, well, what do we do? How do we do it? Mm-hmm. If we're to try to do anything, it comes down to we do it or it doesn't get done. We don't have a volunteer base to draw from as other groups, but
right.
we try. And I think through efforts like you, at least knowing the contact level from you to Kathleen to Michelle and all the way down to Jen and Ronnie in there, it's a little more of a comfort factor now.
Great.
So
I'm
definitely-
happy. Thank you.
definitely
I'm happy
appreciate
to
this.
hear that. One final thing I want to share with you is it is Medicare open enrollment. It's a great time to take a look at your Medicare benefits for anyone on Medicare, to review your choices. Every year, the insurance companies, the Medicare Advantage companies, change their formularies. Prescription drugs that were covered last year might not be covered this year. It's a really good thing to do a review. And that's the other thing our agency does. We are the State Health Insurance Program, SHIP. The acronyms abound in government work, but we are called SHIP, and the SHIP will help someone review their choices for Medicare before the closing date of December 7th, where you are stuck with whatever Medicare prescription drug plan you have for another year. So we do have an 800 number, which is on our website, which is everywhere. I should have brought brochures, and I will make sure Kathleen gets some to bring back to a council meeting. Anyone can call that number. Many Trumbull residents call. We are, as of yesterday, we have saved residents $1.2 million by changing their prescription drug plan to a plan that covers all the medications they're on and is a lower cost. We cannot sell anything. These are unbiased counselors. We're paid through Medicare by the federal government. There is no sales allowed. And it does help open up eyes to make sure that you're going to have coverage for the medication you need.
I'm willing to let you go on all afternoon. Does anyone have any other questions or comments or areas of concern for Marie?
Just thank you for,
Yeah,
this is a very
big thank
informative
you.
presentation, and I think it gives us a lot to think about.
My pleasure. Thank you for having me.
Thank you so much. Thank you so, so much.
Leave you to your business.
Well, interesting.
Promise to come back when next year.
North Central. Right? So more questions. Yes.
As a matter of fact, our meeting agenda, we're going to vote on later on. We should put a little note after one of them, Marie. Dates. Yeah, it's in there. It's in there. Okay.
Very nice to meet you.
I'm Vicki, I want you to meet.
He was going to say something in the.
I assume you'd like to say a word or two.
Hey, Marie, don't go yet.
Hey, Marie, that's an Italian song.
I just want to thank you for sharing that very important information. I will tell you just on a personal note, I took care of my mom for 12 years in my house, and with my family, with little children. So I lived this life, and we, as she aged, I had to get more help in the house for her because it was difficult trying to take care of my mom, who was obviously my priority, as was my children. My husband, well, whatever, but my kids and my mom. So, but when she turned 95, I couldn't take care of her anymore. I could, but not as much as she needed. So she went into the Jewish home, and eventually she had enough money to go into the home. She was there for probably a year and a half when I had to go and I had to put her on Medicaid because I couldn't afford it and she couldn't afford it any longer. And that was a process because I did it myself. And it's a very difficult process. People don't realize how hard it is to make that application and take care of all of that. And when I finally finished it and she was accepted onto Medicaid, I actually cried because I knew if she knew that I had to go and put her on Medicaid. She had lived 95, 96, 97 years taking care of herself, that she would have been devastated to know that. But, I had to do what I had to do to make sure she got the care that she needed. But what I'm trying to say, it's not easy. The whole thing is not easy. And when you have to handle it yourself, because I don't know, I heard about that program, I think at some point, when my mother was already in the nursing home, about what the state would do. But I didn't know about it before that. So, and that's too bad that I didn't. But certainly it's important information. And we struggle with getting information out to people all the time. There's so many ways to reach people, but it's harder than ever to reach people, if you know what I mean. Right? So, we will continue to work with the senior center as we do all the time to push out information. I have my monthly newsletter that I ask all my departments to give me information to push out, just another way to do it. So I just want you to know that we hear that ask for more information about everything. So thank you for what you do.
Thank you, Mr. Sorrow. And I hope Mr. Tessaro is doing better.
Thank you. I'll tell him.
There was an award dinner, or not an award, it was something, I think it was Madison High School, where they did something for vets. And Vicki happened to be one of the speakers there. And she was introduced as Mrs. Tessaro, which,
My name is really not that hard to
Well-
know, but everybody calls me something else. So that's why just call me Vicki.
okay. We try not to be that informal, but thank you.
Thank you again.
Okay, Marie, thank you. Have a safe trip, wherever.
She's awesome.
Yeah. I thought I had quite a few things to cover, which we can cover, which would extend the meeting quite a bit. And I'm trying to look very quickly at what is of the most import. And can we have a motion to approve the minutes from October 25th? We'll get the basics out of the way. We have a motion. Do we have a second? Eve, you're going to second? Okay. Kathleen? Yeah. First or second? I had a secretary report. Michelle, you're here. Do you have anything you care to mention or speak about?
Sure. Ronnie is back at the center. We had a lot of bingo games going today, and it just never ended, so she couldn't make it. So she sent me her report. She just wanted to remind everybody that on Friday, December 6th, from 12:30 to 3 o'clock, there is a holiday art expo at the center. Anyone is welcome to come. Items will be for sale. Items will be displayed. I don't know if anyone here has attended before, but we have very talented artists. Great time to go Christmas shopping. A lot of times the prices are great. The artists deserve, the money that they sell these paintings for. They'll give a discount, but they are worth every penny if you come in and purchase them. Anything from needlework to paintings. They have ornaments, all kinds of different crafts. December 6th, 12:30 to 3. There's a holiday bingo bonanza Thursday, December 19th at 1 o'clock. That's the holiday party this year. Currently, it is sold out. There's a wait list. We are trying to get more people in if we can make room. But there's over 15 sponsors that are coming. They've donated all the prizes. There's refreshments. So it'll be a lot of fun. It's something new. We've never done that before for the holiday party. And then St. Joe's High School on Wednesday, December 18th at 12 o'clock. We ask everyone to come out and support them. Their advanced instrumental class is doing a concert for us. So instruments and the choir and chamber for a holiday performance. And I know that there'll be coffee and refreshments served as well. Someone did ask at the last meeting if we would be hosting a Matter of Balance workshop again. And Ronnie says that we are doing that in the beginning of February. Details are coming soon. That might have been you, Mark.
Fairfield University or Bridgeport Hospital?
Fairfield University. That's it.
Okay.
Thank you.
Does anyone have any need where they have to get somewhere relatively quickly? Because I got about maybe 20 minutes worth of stuff. Everybody good? Okay, so we'll continue on. The chairman's report. Relative to the vet center, from what I had from speaking with Dan Sacco, the foundation is in. We're ready to begin installation of the septic system. With that and the shoring up of the walls for the winter, they're done for this phase. The bidding is to go out now to put the top-on finish on the building. Our best guess is in January we'll select a builder for the top, and it will begin in March. Approximately 9 months to build. So with any kind of luck and good weather, there might be a vet center of some shape and form by maybe this time next year, if not before. It says in the interim, we're talking and working with utilities, electric, gas, and water to get the pipes and wires in place. So that's that. Relative to the the CFBC, the Community Facilities Building Committee, we toured, what was it? What is the facility next to the Grace Church? Long Hill Village. The commission toured that in two groups to look at the facility, to look at the grounds, to talk to the residents who expressed a lot of concern. We walked both pieces of private properties and the village, and we looked at everything from their yards and their perspective. So we got a good appreciation of what they were concerned about. In no real order of priority, but things are mentioned that the concerns primarily are lights, trees, the legacy trees, which I found out is a tree in excess of 200 years old. I never knew that. The noise barrier, how thick will it be? How high will the trees that are going to go in as a barrier will be? There was some water encroachment that from the grounds. Now they're worried about what will happen with the new parking lot. If I'm not mistaken, at the last meeting, they've cut the parking in the rear of the building almost in half now, where there'll be half paved parking and the rest will be just kind of either covered in stone or grass for overflow parking. And noise and the hours of operation. A lot of these things haven't been nailed down, so it was interesting just to see. So now we can give relatively good feedback, first-hand information from the residents of what we heard from them to give to the architects, who have been pretty good in making changes. Okay, so for that, Do we have any guest speaker suggestions along with having Marie back in the very near future, like quarterly? I don't know if that'd be a burden on her, but any other speakers of note? Michelle?
I hope you don't mind. I just wanted to recommend maybe an elder law attorney who could do a general overview. I just think because of what Marie presented with, and it will be televised, for anybody who might want to watch the next meeting, there can be a follow-up on how to, she talked about protecting your assets or ensuring that you are prepared for the future, so maybe a follow-up, something like that.
I
Do you
like-
know of someone in
Yeah.
particular?
Yeah, we can find a few, and if you want it, we can give you a few names and you can call, or if. Oh, sure. Yeah, yeah. So we could have legal services, and then we can find a private elder care attorney in Trumbull, and I can give you a few names, and if you wanted to interview them, or just, or we can call out.
Have
Yeah.
someone in mind.
Okay. All right.
Yeah.
It's a suggestion. I'll get you information if you choose to move forward.
And maybe we'll try that for next month.
Yeah, and maybe you have if you have both someone like Rick Brody from Connecticut Legal Services, who's in the Bridgeport office, because you have different. They work with agencies like mine and with SWACA for people who are in lower income, but another elder law attorney might help with other kinds of planning that you would pay for. So you have options.
I think for this topic, we lean on you quite a bit, Kathleen.
Well, I think you have a good idea. I think an elder law attorney would be a helpful
A good starting
speaker.
point.
Yeah. Any one of
So you're
them.
going to try for next month? Or the month after?
January. Whatever you want.
You think put it out a bit?
Great.
After
How
the hol-
about opening it up to putting it in the bulletin for other seniors to come and listen to this as well?
Yeah, once you, sure. Once you get the definite date.
Yeah, we could do that, coordinate efforts.
Look at something like January or February and not December.
Well,
With
I
the
guess a lot's going to
holidays.
depend on, yeah, after the holidays with the lawyer. I had,
Have we
Okay.
ever considered or do, I'm new here, so forgive me, but
It's okay.
do we ever hold meetings at the senior center itself?
we used to.
Not anymore.
Yeah, next year we're having one in March and one in September.
So I was just thinking, it's elder law is something that that might be one you'd want to have at the senior center, make it convenient for seniors to observe and listen.
So then we would do it in March.
Well, March 28th is the date we have for the center.
Yeah. Could we maybe flip it to February? And then get, I don't know if we want to wait till March to have the.
Well, let's see what the lawyer's availability is, because these schedules we could change within what, a couple of weeks, Barbara? We could change the schedule dates within, as long as you have like 2 weeks notification?
So
Pardon?
Michelle, when you tell
Anytime.
tell us when you can get someone, then we
Yeah.
can switch it to the senior center and then flip flop the other month.
I'm almost embarrassed to ask, has everyone seen the scheduled dates that we have for 2025?
I have not, but I'm sure it's just,
Well,
because
you're-
I just dropped in out of the sky, so.
Well, yeah, that's a point. Thank you for that, Paul. I was negligent in the beginning of not introducing our newest board member, Paul McGeary, who's with us. Paul, welcome. We're glad to have you. And I think I did meet Paul perhaps roaming through his backyard, possibly, this past weekend.
Well, I do live at Long Hill Village, so I've been attending a lot of the meetings on the Grace Church plans, so I've.
Okay, good for that. Yeah, Paul, we'll also get you copies of whatever you need. If you need, like, the schedule, Mark's going to get you the mailing list, the emails and phone numbers and things, so you seem to be fitting in very well already, so that's good. Okay, I'm looking at my list over here of things to jump around on. Blah, 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 blah. Cindy, not to put you on the spot, but I know Vicky and yourself have on some list to get to is the review of all volunteer programs in town. Do you have any progress on that, or? I know that's just another thing on the long list. So
Yeah, it's actually a look at all of our tax relief programs.
okay,
So the senior volunteer tax program is one of our senior tax relief programs. We it's a big it's a lot to look at because we want to look at what we're offering. We want to look at what other comparable area towns offer, see, you know, if ours should be changed or if we recommend that they be changed. You know, we just have an awful lot going on right now. So we haven't been able to make too much progress yet, and it's just, you know, we'll get there, but it's
Well, it's that time of year too, so things are just build
yeah,
up.
and they could have a budgetary impact as well, and you have to understand anytime senior tax relief is increased, then somebody's got to pay for it, right?
Sure.
So all the other taxpayers will have to pay for it. It's a balance, you know, it's a very delicate balance, and we, you know, need to try to take into account all taxpayers. So,
You could say
Yeah.
that about any,
Oh, yeah.
yep,
just seniors. It's
correct. Yep.
Okay.
I know it's
That's
not the
just-
answer you wanted.
No, it's again, it's not. I always oversimplify things until you start talking about it, and then you find out that famous phrase. Well, it's a complex issue.
Yes.
You know, it's a very true statement, and I hate to hear it. But
And it you know, and it really has to be done thoughtfully and carefully.
yeah.
So we don't want to just.
I don't know how much truth there is to this, but Michelle, you may have a better handle than I do. I don't think there are many senior centers in the state that have that program, but there was one that I think Ronnie is involved with, who was looking at copying our program. So I don't think there's many sources of reference for that.
No, I don't think so either. And I know when our program was implemented, I think there were 3 other towns that did it, and I did a little bit of poking around on the internet, trying to look at other towns' websites to see what I could find, and I could only find 2. So I don't know what happened to the 3rd. I've got to dig a little bit more. There's not much out there
No.
to compare.
We're kind of trendsetters.
Are you talking
Pioneers.
about the volunteer program?
Yes.
Not the tax program.
Right.
But the one that.
Right,
Yeah.
right. And there's a state tax relief program as well. So we have a local and a state. So
I have a question, Cindy. I know it's for the senior tax relief, it's graduated based on income, but the graduated levels are not clear. It's not listed on the website, and I was wondering if you could share that with us in the future.
sure.
What the breakdown is. Stanford has it broken
Sure.
down by income level and what the rate is, and
Right.
it's just a sentence.
Right. I'm going to have to double check with our assessor's office, but I think it's written into our ordinance.
Could be.
Because it's in our municipal code of ordinances. And I know I was looking at Stratford to see what their numbers were, and they said to call the assessor's office
Yeah.
for the information.
Because
So
it just says sliding scale according to applicant's income, but it's
Correct.
not,
I think if you look in our code of ordinances, you'll find it. But I'll see if
Thank
I can
you.
bring that next time.
Cool. Thank you, Cindy.
You're welcome.
She's so good to have here.
I could come in.
Okay, I'm running down the list over here. We don't need for new business. We don't need the open commission position any longer, so that's been addressed. Thank you, Paul. Discussion of possible selection of commission secretary. Would anyone here? Well,
you don't really need it. But we're not talking about what is that person? She does all the work.
don't tell her.
She knows it. How could she not? So really, that person
Well,
just
we
doesn't
could
really
kick
do
that
it.
around. We want to be a formal commission. We want as many titles as we can.
is it in the bylaws?
Probably not.
No, it's not. And
Cindy, is
they do absolutely
No?
nothing. So we'll just have it's like a line item. Let's redline it.
Will someone make a motion? We could delete the position, and if that's the case,
Make a motion to delete the position.
I shouldn't have asked.
I second it.
I'm just a glutton for punishment, aren't I? Okay, so that's good. One less issue to deal with, one less person to call out at our meetings.
You can vote on it.
We do? Oh, can we have a vote on dispensing with the secretary's position? All in favor say aye.
Aye.
Me too. All in favor say no. All opposed say no or nay.
Either one.
Sounds to me like the yeas have it. Okay, it is a gone position. So much for that. Discussion of the approval of dating. Did everyone have a chance to see the dates? I think, Eve, you said no. Well, let's just postpone voting on until everybody sees it. I'll make sure everyone gets a copy of this so we have it for next meeting.
It was emailed to everybody.
Oh, do we have it? Is that where we got it from? Oh, okay.
Barbara did that already.
Barbara did it. I have a.
Of course. She did. I think you did it twice tonight. Yes.
Thank you.
I know you did, because I got a second, I said,
It looks fine.
Okay. So as I said, these dates are pretty much, we're okayed. I think Barbara kind of confirmed there's no major holidays, no real conflicts with any of the dates. If anything comes up, we can change within a matter of days, hours, whatever. Okay. So we can I have a motion to then to accept the meeting dates for 1925. 1925. Wow. 2025. Do I have a motion to accept these dates? We have a motion. We have a second. Everyone in agreement with that?
Yes.
Okay, so passed. Done. That was the last item on the list. The next thing says the next meeting is December 13th, 2024 at 2 o'clock. 13 is my favorite number, by the way. Not that anyone cares. I have 13 letters in my name. I was born on the 13th of the month. I was married May 26th. There's a multiple of 13. Little things like that.
I have a son born in July.
Michelle?
Taylor Swift have a lot in common.
Who?
Taylor Swift, that's her favorite number, and everything happens on the 13th.
I had it first. She's younger than I am.
I had a son born on July 13th.
Good day.
Friday, July 13th.
That's my favorite day.
Chairman,
Yes, sir.
that will be here.
December, yes.
Yes. Yeah, all the dates that aren't stated will be in this room. Unless the location has changed, and you'll be advised.
Is that the first time you've had a sign on the doors as we're coming in about the meeting? I thought that was kind of nice. I never saw it before.
Coming in where?
Coming in, all the doors said the Commission on Aging is in. Yeah, you didn't see it?
No, that must have been Alicia, I would think. Or did you do it, Cindy?
Alicia.
Yeah, no, Alicia's,
I
she's
thought that was the
super.
first time I've seen it. Have you done it before?
I don't know why she did it.
I thought it was very nice. I said, oh, wow.
Well, on
Tell her
that,
that I saw it and appreciated it.
on that happy note,
Thank you.
would anyone care to make a motion to adjourn this happy festive meeting? Eve, thank you for the. Paul, well, welcome and thank you for the seconding. Does everyone agree with terminating our meeting? Done. Stay happy and healthy.